Doctors making house calls used to be the norm, but by the 1980s, these types of visits dropped to less than 1%. Now, they're on the rise once again, and one of our local hospitals has been a trendsetter for in-home healthcare for more than 20 years. Dr. Eric DeJong wakes up each day to make an impact. It starts in Office 213 at Medstar's Washington Hospital Center.
I come in and I kind of get prepared. I get to look at my schedule and see what patients I'm going to see. I take a bunch of notes, map my own route.
And make sure his military medical bag is stocked with
devices to do wound care, ear and eye exam, gloves, gauze, thermometer.
What he needs to make his rounds, not in the hospital, but in his car, driving some 1,200 miles a year to his patients' homes.
Hi, Ms. Wood. How are you?
Fine. Come on in.
Dr. DeJong co-founded the House Call program more than 2 decades ago.
And the need was massive. You know, there's a huge number of patients in Medicare and in DC who are very ill, homebound, have trouble getting to the doctor, and land in the ER or the hospital with unnecessarily.
It was a way for him.
All right, can we go over your medications?
And his 15-member team of doctors, social workers, coordinators, managers, and nurse practitioners.
So much better to go to their houses, see how they live, what they actually eat.
To deliver health care to a very vulnerable and needy geriatric population.
It's very interdisciplinary, meaning the patients and the families need all of those types of services to stay well, to age at home, to get everything they need at home. And I'm just going to listen to your heart.
Former business owner Richard Wood had a life-altering accident driving his recycling truck back in 2003.
It broke my spinal cord.
The toll of shuttling from nursing home to nursing home, doctor's offices, and rehab appointments took a toll on Richard and his wife of 60 years, Evelyn. The House Call program came along at just the right time in their lives.
X-rays, no matter what it is, blood work, whatever. It's done right here. It has enhanced his life quite a bit.
Karen Pollock.
And how's your blood pressure been?
It's been fine.
Was diagnosed with progressive multiple sclerosis in 1994. The former ER nurse says access to the program's 24-hour care is reassuring and comforting.
After hours, you can call, and there's a physician you can talk to. With the House Call program, I feel like I am a person and a patient.
Feeling the impact that you can have, not just me, but our team has on a daily basis, and relieving suffering, keeping them out of the crazy ER, being available to them, you know, after hours, and having a team in place that we can be a lifeline for them. That actually, you know, at the end of the day, that makes it all worthwhile. Any pain in your foot? And our goal is to prevent a crisis, prevent a crisis of stress on the family, prevent a crisis of a 911 phone call, prevent them from landing in the hospital.
And according to the American Academy of Home Care Medicine, that saves from $1,000 to $4,000 annually per patient.
I'll write out some instructions here, but any other questions for me? I think it's the future is to do care in the home, and I think care in the home is better for this subgroup of really high need, more ill patients.
Now, Dr. DeJong says Medstar's House Call program has been one of the most powerful interventions in the healthcare industry in the last 30 years. That's because it allows insurance companies to reduce the total cost of patient health care. He says it's also a win for taxpayers.